Bismillahirrahmanirrahim. I am Dr. Shahlla Kanwal, working as consultant gynecologist and obstetrician in Tertiary Care Hospital, Lahore, Pakistan. You are watching my YouTube channel. Please subscribe and press the bell icon so you can watch every video which I am going to upload in the future. This YouTube channel is about my skill demonstration and gynecological surgeries you will see in the future. So what I am going to present today is operative vaginal delivery. The incidence of operative vaginal delivery should be 10 to 15% in maternity units. 10 to 15% will decrease the cesarean section. Operative vaginal delivery includes ventouse delivery as well as forceps delivery and Omni cup delivery. The difference between ventouse and Omni cup delivery is this is an Omni cup, but the ventouse has a large machine of the suction. So this avoids that large or the big machine of the suction, and it has its own suction apparatus. So this is more like an easy procedure than the ventouse delivery. So in the exam situations, when you are going to present the skill demonstration, you have to start with, after fulfilling all the prerequisites and ruling out all the contraindication and preparation of the patient. What could be the prerequisites? Prerequisites will be the cervix should be fully dilated, membrane should be ruptured, presentation should be vertex, and vertex should be occipito-anterior position. There should be no cephalopelvic disproportion, and on abdominal examination, baby should be of term fundal height or baby should be of more than 37 weeks, and there should be adequate uterine contraction, 3 contractions per 10 minutes, and every contraction should be of less than 1 minute. These are all the prerequisites which we should follow for the ventouse delivery or the Omni cup delivery. The contraindication will be the fetus should be there should be no preterm and term fetus can only delivered by this operative vaginal delivery, and there should be no face presentation and no cephalopelvic disproportion. How we can prepare the patient? The preparation of the patient is you have to explain all the risks and benefits to the patient and take the informed consent. The patient should be in lithotomy position. Bladder should be empty, gowning and gloving before the procedure, and reassure the patient. Make sure the presence of 2 assistants, 1 pediatrician and anesthetist, as well as you have to, assistance is also required for the perineal support. As for the delivery of for this operative vaginal delivery, you have to put the patient in lithotomy and you have to clean the vulva with the antiseptic solution. After cleaning, now its patient is ready. First of all, what you have to identify regarding the point of view of the fetal head is the flexion point. What is the flexion point? Flexion point is on the fetal head, that is 3 cm anterior to the posterior fontanelle and 6 cm anterior to the 6 cm posterior to the anterior fontanelle and 3 cm anterior to the posterior fontanelle. This is the flexion point where we have to apply the Omni cup. This after identification of this flexion point, you have to measure the insertion distance. The insertion distance can be measured when you have to know about the length of your middle finger from the tip of the middle finger up till the proximal interphalangeal joint as well as metacarpophalangeal joint. The normal distance from tip of the middle finger to the proximal interphalangeal joint is around 5 to 6 cm, but up till the metacarpophalangeal joint, it is around 10 to 11 cm. You have to introduce to your fingers and identify the flexion point, and you will see where your finger are touching at the posterior foreshead. This is the posterior foreshead. Please come closer. This is the posterior foreshead, so it should be at the level of the posterior foreshead. You have to measure your distance of the finger, and ideally it is 8 cm. After that, this is the Omni cup. Omni cup, this is a foam where it will, this is the cup which has to be applied over the fetal head. So this cup, then this is suction tube, this is suction operator. Here is the pressures or the how much pressure you have to apply over that. And this is the suction, by applying this force like that, you can apply the suction pressure. Here it is not written, but in certain Omni cups there is a written of the traction pressure. The traction pressure should be less than of 25 pounds, and there should be less than 25 pounds. If there is around 12 pounds and 9 kg, you should be cautious, and you have not to be like consider the Omni cup delivery. So how you will apply the this Omni cup? This is the flexion point. You have to apply this flexion. You have to apply this Omni cup over this flexion point, and you have to hold with these two. Before application, first you can check it over your own hand to create the suction pressure, so that apparatus can be checked like that. You have to move like the whole of this red, the whole of this up till green should be inside. To relieve the pressure, you have to press this button and the pressure will be released. So you will apply here over Omni cup over the flexion point. After application, you have to hold it with thumb and the finger, and you have to apply the pressure, because it can't be created the vacuum here. I have created the vacuum on my hand. So after application, up till that the pressure should be applied. After the application of the pressure, you have to hang it down like. After the application, first you have to apply the cup, then you have to hang it down. When you will hang it down, you have to see where it touching. It should be around 8 cm. If it is not 8 cm, then you have to move the Omni cup more towards the medial side or downward side or upward side, so that the insertion distance which we have measured should be according to that distance. So then you have to apply the pressure. Measured with 8 cm. If it is not 8 cm, by touching at the posterior fourchette, you have to move the Omni cup down or slightly towards the medial side, so that complete 8 cm or on the insertion tube should be according to the insertion distance. There is the two marking 11 cm and 6 cm over the insertion tube, and you can easily measure the distance. After that, you have to create the pressure. When you create the pressure, the whole of the bar should go inside. This should be around the pressures, only the red portion should be visible. When you have to apply this pressure, the baby's head will be delivered with the maternal uterine contraction as well as with the maternal pushing effort. This should be the delivery of the fetal head. After the delivery of the fetal head, this is the delivery of the fetal head by the Omni cup. You have to press this button so that the pressure is released. After releasing the pressure, now the head is delivered. Complete the delivery in the usual fashion, and do the active management of the third stage of labor, and check for any after the delivery of the baby. Put the baby on the maternal abdomen for the early essential newborn care. You can when you have delivered the baby, you can put the baby on the maternal abdomen like that. Early essential newborn care include drying of the baby, early initiation of the breastfeeding, and delayed cord clamping. In delayed cord clamping, 1 to 3 minutes you have to wait, and then you can cut and clamp the cord. After the delivery of the baby and the placenta, you have to check for any kind of lacerations, any kind of tear, and if there is an episiotomy, stitch the episiotomy in the usual fashion. But after the delivery of the baby, you have to check for any complications. These complications could be like chagnon, there could be the subgleal hemorrhage or intracranial hemorrhage. This is after the delivery of the baby with the Omni cup. There should be the proper documentation of date, time, and where baby has been delivered, and what is the APGAR score. If there is any complication, document these complications. Thank you so much.